Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
I would like to welcome everyone to tonight's webinar, the Primary Care Toolbox. This is part one on how to add a health coach to your primary care team, and we're thrilled to have Dr. Susan Butterworth with us tonight with the Tennessee Heart Health Network. Just as a reminder, you will get a survey. Now, we're doing things a little bit different this time. So don't log off when the meeting ends. You will receive a survey link to go ahead and immediately fill out your survey. If you don't, please let me know. So just remember, do not log out as soon as it's over. Take care of the survey link, and then I will get your CME certificates out to you. Should be able to do that tomorrow for you. So we just really thank you for being here. Like to tell you a little bit about Dr. Butterworth. She is currently an associate professor at the Center for Health System Improvement at the University of Tennessee Health Science Center and Director of Patient Engagement for the Tennessee Heart Health Network. Her clinical background is exercise physiology, and she received her doctoral degree in adult education and training with a cognate in health promotion from Virginia Commonwealth University. Susan specializes in the application of motivational interviewing-based health coaching interventions in healthcare and is well published in this area. In addition, she has been awarded or served on multiple grants to assess the impact of health coaching interventions in healthcare organizations, including health plans, hospitals, and clinics. And she's been a member of the Motivational Interviewing Network of Trainers since 2002. So at this point, again, I want to welcome you, Dr. Butterworth. Thank you so much for being with us, and we appreciate the Tennessee Heart Health Network partnering with the AFP to bring this to our members.
Thank you. I'm happy to be here, and good evening, everyone. This is going to be a small group, so it's going to enable you to ask lots of questions, and please feel free to interrupt with any questions. You can use the chat, and Karen will be monitoring that. At the Heart Health Network, we have ongoing learning collaboratives, several each month. So if you enjoy this webinar and the subsequent ones, feel free to ask to be put on our mailing list. We would love to see you at future learning collaboratives. Today, we're going to talk about how to integrate non-clinical staff, such as a health coach or community health worker, into a team-based care. We're going to identify billing codes that have been approved recently by the MCOs to use for these activities. We're going to talk about best practice approach for both training as well as in terms of integrating health coaching in a clinic setting. And we're also going to give you an opportunity, if you want additional CE credits, to do a follow-up planning activity. I want to ask you first, before we jump into our data, is what do you know that you should be doing, but you're not? And you don't have to share it with the group, but I just want you to think about it in your mind. Eating more fruits and vegetables, managing weight better, exercising 30 minutes a day, getting 8 hours of sleep, managing our stress, taking that supplement, doing those back exercises or anything else. So I'm wondering if people here would raise your hand if I said, hey, raise your hand if you're having trouble with any of these. I know I could raise 2 hands. And the point I want to make here is that we are competent, capable healthcare professionals, and we still struggle with lifestyle management. And so we can imagine what it's like for some of our patients that struggle with chronic conditions and lifestyle management and also have a lot of social risks. So this is an area that is not easy for even those who know what we should be doing. The next thing I'd like you to think about is, what is your biggest barrier or challenge? So with the area that you just identified in your mind, what gets in your way? And this is something to, again, just to think about. Some people will say lack of motivation, and some people will say, well, I've tried before and I do it a little bit, but can't keep it up. We kind of all have a barrier or challenge. And when we surveyed a lot of individuals who had joined a wellness program, we put together a word cloud. They may not have said self-efficacy, but they said words like, I'm not sure I can do it, which is confidence. I don't feel like my efforts make a difference, which is agency. I'm just not motivated like I should be. Or they named some social risks that got in their way. And time was also mentioned. Knowledge was not mentioned very often. It wasn't that they didn't know they should do something. I think we do a really nice job in public health and also in our clinics and our PCP clinics in terms of helping people know what it is that they should be doing. It's just really hard to do. So we're going to talk about the benefits of health coaching, how this can be helpful in a clinic setting. I mean, I want to make the case first. I think you're interested and you know there's a case or you wouldn't be here. But we know that, half of the health determinants that we're looking at are lifestyle related. We know that many people have multiple chronic conditions, and those chronic conditions aren't treated the same way as acute medical care. People have an amazing number of prescription medications now, especially people that have multiple chronic conditions. This costs us a lot of money in our economy, and these are direct as well as indirect costs. And, we look to our PCPs to kind of grapple with this. Well, they only get about 16 and a half minutes that they get to spend with their patient on average, and it takes them over that to complete their EMR for each patient. And so we really, kind of put a lot of undue burden on our providers to try to tackle all of the health coaching, all of the chronic conditions. We also are going to talk a little bit later about now we have the number of codes that will reimburse coaching sessions with non-clinical providers. And so we're going to talk about how that can kind of help us make the load a little bit lighter. I want to assure you, though, that our literature is clear that the practitioner does matter. When we talk about people that are successful, people that have good clinical outcomes, we know that when patients have clinicians who are empathetic, they have better results and they have better medical complications. We know that when we control for characteristics, the factor of therapeutic alliance was a very significant and independent predictor of a change in patient activation scores. And we also know that patient satisfaction goes way up if people feel like they're listened to, respected, and valued as individuals. And this isn't even taking into account your knowledge, your expertise, and some of your suggestions. So just that connecting and engagement with the individual really does matter. For today's purposes, we're going to talk about the fact that health coaching is the use of evidence-based communication skills and strategies to engage and guide patients towards any type of targeted health goal. So this could be a health behavior change. This could be managing chronic condition. This could be adhering to their treatment plan or just following through on a referral that we give people. So if you're working with patients in any of these ways, you are providing health coaching. So the role of a health coach, we can say, is to apply these communication skills and these strategies to engage the patient, to increase motivation, to help them make a change. We're going to help people identify and achieve goals regarding their chronic condition and lifestyle management. And a really good health coach is going to empower patients by addressing their self-efficacy and their sense of agency for not just managing their health, but also navigating the healthcare system. And we know how difficult that can be. You've probably heard of patient activation. I was lucky enough to be colleagues in Oregon with Judy Hibbard. And she did a lot of research that pointed out that although knowledge and skills were really important, when it comes to activating a patient, they first have to feel empowered to take charge of their health. And then they also have to have that self-efficacy or confidence. And that's kind of the bottom of this pyramid. So all too often we start patient education and we start with knowledge and skills, where in health coaching, activation is so critical. And we know that we have to start with the empowerment and the confidence first. So this Chinese proverb, give a man a fish and you feed him for a day, teach him to fish and you feed him for a lifetime, is really apt for this. When we talk about best practice in medicine, we're not just flipping a coin like this doctor is doing. We truly know best practice for diagnosis and for treatment. Well, there's also best practice for patient engagement. And so the traditional medical model, which works really well for acute medical care, just doesn't work well for chronic condition and lifestyle management. We're supposed to just tell people what to do, how to do it, and why to do it. And then ideally, they'll just do what they're told. But in a patient-centered model, a more best practice model, we need to build rapport, express empathy, validate barriers, elicit their narrative, their story, and evoke change talk. And when we do this, we know that there's a better correlation that patients are going to become more activated or empowered to take charge of their health. They're going to be more successful in navigating the healthcare system, and they are going to be more engaged and successful in managing their chronic care and lifestyle. I wanted to talk just a little bit about appropriate and best practice training for health coaches. Because health coaches focus on patient needs, they address constructs that help them identify and meet their behavior change goals. And this is going to include things like problem solving and self-awareness, and helping to build resiliency, and helping to marshal social support, being aware of the resources, and helping to build motivation. And so all of these constructs that are so critical, the health coach really does need a deep understanding. And there's definitely psychology involved here, but it's not a counseling type of situation. It's a situation where we need to be aware of, what are the factors that really get people engaged and moving on their issues. There is health coaching theory and framework that can be very helpful, because if we understand behavior change, if we understand the theory and the research that's gone into these models and theories, then it does help us, really link to the strategies that are going to address things like people's self-perception of themselves and what they want. It's going to help them build that self-efficacy, build that activation, go through those stages of change. There's a communication approach. It's not a theory or a model, but it's a communication to help people strengthen their commitment to change. You've probably heard it. It's called motivational interviewing. And it's the only health coaching approach that's fully described and consistently demonstrated with positive clinical outcomes. And we'll talk a little bit more about the research. So I want to make sure that we understand it's not either or. We do want to use advanced health coaching strategies and be aware of the theories and the models that have been around for decades. But this approach really goes hand in glove and is very congruent with them and can be used in all types of situations. So why do we use motivational interviewing? Why is it the best approach? There's over 5 meta-analyses now that demonstrate the efficacy of it in healthcare. There's over 1,800 clinical trials in all areas. In a study where I was involved, we increased enrollment by 4 times from usual care. It's the only one that has standardized and validated assessment tools, and we do provide structure for the clinician, engaging, focusing, evoking, and planning. It's been studied for over 40 years, and it's the only, again, approach where we have multiple studies and meta-analyses that are associated with published outcomes. It's being taught around the world now in over 52 languages. I do want to add that motivational interviewing is not enough. I can have excellent communication skills, but if I'm non-clinical and I'm in a clinic setting, it is important that I receive additional training. I need to understand chronic care, lifestyle management. I need to understand symptoms that might cause me to refer the patient back to their clinician. I need to understand how to be a patient advocate, how to administer assessments such as social determinants of health. I need to be able to provide resources and referrals that the clinic has access to. I need to truly understand the social determinants of health in the communities in which I serve. And especially if I'm working with populations with diabetes or smoking cessation, I need to have a lot more information about those topics so that I can adequately address it. So again, a health coach can start out in kind of an introductory level, being able to engage people, outreach, especially to help them, come to screenings or to come to the clinic. But if I really want them to make complex and tough behavior changes, then I really do need to have more advanced strategies. I thought you might be interested in some of the research to look at the benefits. I'm not going to do a deep dive into a comprehensive review. So this is kind of selected research that I thought you might be interested in. If you look for these citations and you can't find them, I'm happy to provide the articles. And also we'll provide you with these slides afterwards, so you don't have to feel like you have to take screenshots or try to jot down these references. You can see here that there's a lot of references in motivational interviewing for the outcome variables that we want to see in our patients. Patient engagement, activation, self-efficacy, medication and treatment adherence, perceived health and quality of life, the readiness to change, and then all kinds of clinical outcomes, especially in the cardiovascular realm, such as hypertension and other lipids. Again, this is not to say that this is a magic bullet, but we have found that health coaching using motivational interviewing can help people follow their treatment plan better and become more motivated to kind of stay the course. I thought this cluster randomized trial was especially interesting for your group because it talks about the benefits of a 2-year health coaching intervention in clinical practice. The goal was weight loss. It was in the South in Louisiana, and you can see it was either usual care or the intervention, so a randomized trial. And it was 24 months, which is great because, a lot of times we'll have like a 6-month study and everybody does well, but we know that after 12 months, people pretty much come back to the baseline. And so this was followed for 24 months. And they had, it was embedded again in the clinic setting, and they had weekly health coaching sessions. You can see here that in the outcomes, they lost significantly more weight, and it was not just statistically significant, but it was clinically significant. Their fasting glucose decreased at 12 months, but not at 24. They had they had increased HDL, and that was at both time points, 12 months and 24 months. And then all kinds of their lipid ratios improved. And this was at both 12 and 24 months. And this is, again, the citation if you want to look this up. But again, this is just one example. But I thought it was a very well done intervention, and they described it really nicely. I don't want to leave out the outcomes for community health workers. In the literature and in Tennessee, we're talking about health coaches and community health workers very differently, but they do a lot of the same things. And community health workers do a lot of health coaching along with their patient navigation. And so I wanted to provide you with some of the results from some of the clinical trials that have been done. They've improved access to healthcare services, increased health and screening. They help people have a good understanding with their health and social service system. They can enhance communication between community members and health providers. They can increase use of the healthcare services. They improved adherence to health recommendations and reduce the need for emergency and specialty services, which helps with cost. So you can see here that, again, community health workers can also be of great service to our clinics. Just a couple of words on some latest research that I've had here. The first in Tennessee, Dr. Jim Bailey at UT, who I work with, was the PI, and we were looking at managing diabetes in African Americans at risk. And we had 3 arms. There was no usual care. It was enhanced usual care, which is a little bit different. And then we had text messaging and we had health coaching. All 3 arms saw some nice outcomes. And I wanted to just give you the significant outcomes in the health coaching arm, because this is what we're talking about tonight. We had improved A1C, reduced BMI, improved diet, increased physical activity, and increased self-efficacy. Those last 3 were self-reported. One thing that was of great interest was the text messaging had really nice results in medication adherence, whereas the health coaching didn't. But when we went back and looked at the records, it's because the health coaching was focused really a lot on what was important to the patient, and the patients wanted to lose weight, and that's what they talked about. So, the lesson there was that it's important for the health coach to look at other risk factors and ask for permission to work on more than one change goal, and to be a good guide to bring up risks. So instead of, following the patient or directing the patient, we want to be right in the middle and helping to guide the patient there. I thought another study that might be interesting that we finished up a couple years ago was a clinical trial where we're really looking at healthcare spending and clinical outcomes. And this is for people with pain, spine pain. And so, a lot of times people will rush into surgery. And so we were trying to avoid that. And so we had 3 treatment strategies. There was a usual primary care. There was a PCP-led care with some decision-making, and physical therapy with the health coaching to try to help them adhere to their PT plan. And then they had another PCP-led care with treatment that was directed. It's called IPT care model. And again, I'm just gonna, there were some significant outcomes in numbers 2, the treatment ones, numbers 2 and 3. But in the health coaching arm, we had improved disability, and the total spending was lower than usual care. So that is good news to say that even with people with severe pain, this wasn't chronic pain. This was people that hurt their back, that had pain. We can make a difference using health coaching. So I'm just going to pause there and see if anyone has any questions before I go into a step-by-step process of building coaching into your clinic setting. And we'll also have time at the end. So
yeah, I don't see any questions at this time.
Thanks, Karen. So in terms of a step-by-step process, this is simplified. I'm going to tell you where to go to get more information, but I did want to make this, basically a 10-step process. I know there's a lot of moving parts, but I have worked with clinics to develop health coaching interventions, and help to implement them into their clinics. And we do have some lessons learned too, if you're interested, that we can talk about some things that went wrong that, we want to try to avoid. So hopefully this planning process will help us avoid a lot of those missteps. So step one is to start with identifying the key contact staff from your practice that are going to plan and oversee this intervention. Someone's got to be in charge. Someone's got to take ownership. Someone has to really oversee the process. That doesn't mean they have to know what they're doing. When I say know what they're doing, they may have never worked with health coaches before. They may not be experts in health coaching. This is more of making sure that somebody has a handle on all these components that need to be completed.
Dr. Butterworth, we
Yeah.
do have a question, excuse me. So what qualifications or training is needed to be a health coach?
Yeah, so I covered that in the beginning of the session where I talked about the health coaching theory and models. We talked about motivational interviewing that should be trained. We also talked about additional training depending on the clinic setting and the population that's going to be managed. So all of those are important for training health coaches. I'll also share a little bit about our training and certification program so that you get to see a little bit more about that too, in towards the end of the program.
So who is the person responsible for the training?
Well, that's going to be usually you're going to find in a clinic. You probably do not have internal expertise. And so that probably needs to be farmed out. And when I say farmed out, there's lots of programs. We have identified 3 programs in the state of Tennessee that the MCOs have approved for being providers for the billing codes that I'm going to talk about in a few minutes. So I can certainly share those organizations with you. There are other organizations in the nation and in the state that do provide training, but I will say that, it's important for the clinic to provide the clinic onboarding and to talk about the workflow and the protocols and how to do the documentation, collect the metrics that we've decided on. But in terms of training a health coach, it's going to be very unusual to find someone on your staff that has that expertise. Part of my job for the coalition is to help you find those resources if it's something that you're interested in doing in terms of training. I'm happy to do that. So step 2 is to identify the risk factors or population at risk that you want to address and determine metrics for success. Some of the clinics that I've worked with have wanted to do a pilot program to start small. What is their biggest pain point? Do they want to just look at people with hypertension right now? Do they just want to look at people that have prediabetes to try to, or people that are out of range in terms of their A1C? I don't recommend, trying to cover everything at once when it's brand new to your practice. I would recommend starting with a particular population, particular risk factor, so that you can identify and measure if your health coaching is being successful. Step 3 is to implement the CPT billing codes that I'm going to tell you where to go to look at those. These reimburse for health coaching services or non-clinical services. Step 4 is to identify your health coaching staff and formalize their role in your practice. Some of the clinics we've worked with have taken existing staff who have an interest, whether it's a medical assistant or a care coordinator, and then they have modified their existing role and they've designated health coaching hours. Other clinics, especially the ones that I worked with through the model program here in Tennessee and also the clinics in Oregon where I worked, they hired new health coaches. They posted a job description, they hired them, they provided the clinic orientation. Then, as we just talked about, we do need to provide training, and I suggest that you do provide the training that meets the certification and standards that have been identified from the Tennessee MCOs for health coaches, so that there's no problems using those CPT billing codes. Step 5 is develop a plan for patient outreach and referral. This can be warm handoffs, which are very effective. It can be outreach, getting, using the database, and pulling out individuals and then outreaching them either by telephone, by email, by text. But this would be the health coach, basically, calling from the clinic, trying to get either a telephonic health coaching session, or again, they can visit the individual when they come into the clinic. Step 6 is you have to train your staff how to use these new billing codes. And we do, again, have some vested interest in helping you look at the ins and outs of these. And the MCOs also have stated that they will assist clinics if they're having questions about how to use these new codes. We need to develop documentation protocols. How are the health coaches going to document their work, and allow you to collect the metrics that you need to see if they're being successful? How are they going to interface with the EMR? Step 8 is to introduce the health coach intervention and the staff to the providers so that everyone's aware of what they're doing, what their first steps are going to be, and you really want to try to develop physician champions. I have found that the most successful health coaching based services and clinics are where there was 1 or 2 physician champions that really started out and then it spread. Without those physician champions, it's really a hard uphill battle. Step 9 is to go ahead and start that intervention, and then it's important to implement QA checks and corrections along the way. There's going to be a lot of iterative evaluation. There's going to be some bumps in the road, some barriers and challenges, and we just plan for them. Again, I'm happy to share some of the lessons that we learned, but I think that if you start out having these QA checks, checking the referrals, checking the outreach, checking the documentation, the follow-up, you're going to be much better served. And then step 10 is to provide ongoing support and training for these health coach staff. They really need to be fostered and mentored just like any other young professional. So, we have these 10 steps, but I want to provide you with resources in terms of, okay, so how, I'm interested, I know these steps have to be done, but what are my resources? First of all, this is a sample of the service codes that have now been identified for health coaching services. And the MCOs really did over the last year. We worked with them. Dr. Cy Huffman really led a subcommittee group from our consortium. He's from Blue Cross Blue Shield of Tennessee. And they not only agreed on these codes, but they've run tests to ensure that they're going to be reimbursed, they're going to be honored. And we're not going to go through, we don't have time to go through all of these. So this is just a partial list here, but I wanted you to see that there's notes about how to code and, these and comments and, giving you some more information other than just the code. For the full list, you can see that we have a website. And if you go to that website and then go to resources and reimbursement, you're not only going to find this list, but you're also going to find FAQs. And we know we're going to have questions that come up, and we're definitely committed to adding to this document. And if you have a question about using these codes, we will find the answer out for you. The MCOs, have said that they also have representatives that work with the clinics and that they're happy to work with you on this as well. We have a toolkit for health coaching intervention, and it kind of runs through everything that I just ran through, but in more detail. There's something called a function and form, which we're going to provide for you. And that is a good planning document to kind of help you get started. And you can see here again that if you go to that same website and go under health coaching, you'll find this toolkit, and that can be of great help to you in terms of looking for ways to get you started. I also wanted to say again that I'm available to assist if you decide that you want to try to develop a plan to include health coaching. I'm happy to assist. I also have a colleague as part of our department named Ashley Ellis. She's in the pharmacy department, but she is a guru when it comes to implementing these billing codes into practice. So if you have a question on these billing codes, I'm likely going to hook you up with either Ashley or one of the MCOs. You mentioned like, well, where do we get trained? We're not the only health coach certification. Vanderbilt has a really good one. It's a lot more comprehensive and longer than ours. We have one to kind of get people started. It involves 2 steps. It's a motivational interviewing certification program, and then a chronic condition and lifestyle management program with a health coach or a community health worker track. Both of our programs are asynchronous and online, so they're good for people who are working. They take between 10 and 12 hours. They're very interactive, especially the motivational interviewing one. There's practice activities. At the end, there's a standardized patient activity for a competency assessment. And then for the chronic condition program, there's a case study that we use as a competency assessment. So when someone has gone through both of these programs, then they get a health coach certification and they are ready to begin health coaching. Again, I still recommend that they receive additional training in the clinic, depending on the population that they're going to be working with. The other 2 programs I mentioned, Vanderbilt and then Coalition for Better Health, works with organizations to train preventative specialists. And they generally work with nurses to train them into being, again, certified as a health coach. So all 3 of these programs have been approved by the MCOs as being qualified to work within the clinic and bill for these health coaching services. And this is the same website that I've given you before. And this training website allows you to go and sign up if you want any of your staff to take. And some clinics just opt for people to take the motivational interviewing program. They feel like they may be using nurses who don't need the chronic condition course, who just need the motivational interviewing. And so we have many hundreds of practitioners that just go through the motivational interviewing program and don't go through the full health coach certification. I get excited about health coaching in the clinic setting, but I'm not Pollyanna. This is not easy to do. We're still a little bit ahead of the curve, but as Steve points out, the hard thing to do and the right thing to do are usually the same thing. I did want to mention that there is a follow-up activity for additional CE credit. It's basically filling out the function in the forms document. You can contact me for assistance. You try to integrate health coaching into your practice, and then you fill out a post-activity response statement assessing whether the implementation was successful. And we give you 6 months to do this. And again, as much as assistance as you need. And Karen can tell you more information about how to get that additional CE credit in terms of how to apply for it. I did want to just pause here and see if we have questions and comments. And I'm interested if anyone here is already has health coaches in your clinic, and I'd love to hear your experience.
Thanks. Yeah, I appreciate the presentation. I guess I first heard about health coaching a few years back and didn't know about any local resources or anything, and found out that about Vanderbilt's program for training. I guess mostly their registered dietitians are, I guess, made available for that. So have worked with a few registered dietitians who have had the training with motivational interview, health coaching and stuff, and found it to be very helpful. But I don't have any staff on site that are able to do that. But if I'm able to add staff, that would be something I would look to add. Curious where if there's organizations or such as yours that where I might be able to find out who is looking for a position as a health coach and that sort of thing. Where might I begin to look for someone like that?
So one of the things that we do provide in our resources in our toolkit is actual, like a job posting for a health coach. So we've actually put together a job posting for you, so you can kind of see the general credentials, the job roles. But essentially, I would say that you would post for the job in the normal ways, but I would also do networking with the certification programs in the state, such as Vanderbilt and such as ours, so that, because we know the people that have been taking the courses and that have been graduating. But I think that you'll find that, when we post for a health coach, because we've hired recently for our neighborhood health hubs, we'll get 20, 25 applicants just in a couple weeks time. So the people are out there, and a lot of them have health promotion degrees, exercise physiology or health promotion degrees. You don't have to have a college degree to do health coaching, but a lot of the health coaches do. And a lot of them actually have their master's degree. Whereas a lot of community health workers don't have a college degree, but again, they can also be taught to deliver health coaching.
I've seen some things in the medical literature about physicians even getting training in motivational interview and that sort of thing. Do you know about any resources like that for physician training?
Absolutely. I've trained physicians in motivational interviewing for 20 years, and I have found that the people that self-select are highly successful. If people are interested in this, they're and passionate about wanting to get better at connecting with people, then they are wildly successful, and they go through our motivational interviewing training, the one that I talked about online. And we do provide, by the way, a 50% discount for our community partners, and we're partnering with this organization right now, so you would qualify for our 50% discount. Just reach out to me back channel. There's other good motivational interviewing trainings that you can find either in person or online. We're not the only one that you can go to. I always tell you though to make sure that you choose an instructor that's part of the motivational interviewing network of trainers, just because you know that they'll be well trained to teach it.
Excellent. Thanks again. Appreciate
Thank
it.
you. And I'd love to hear back from your experiences with it hiring those health coaches for your clinic.
Yeah.
Okay.
Okay.
It looks like Elizabeth has a question about services being delivered in supervisory requirements. Yes, these non-clinical staff do need to be supervised by a clinical staff. Right now, that consists of your typical providers, whether it is a physician, a nurse practitioner. They're looking at pharmacists, whether pharmacists will be able to oversee this, and that decision has not been made. And if you have questions about, what's billable and if it's in the office or not in the office, I really encourage you to download that document about billing codes. And if you still have questions, to reach out, because a lot of these questions have been posed and discussed and talked about, and I can get you that information. Unfortunately, again, I'm not the guru on the service codes, but I can definitely find out the information for you.
And I can send those, when I send the CME certificates out, I can send those links as well. So they'll be readily available.
And Karen, if you want, I can just send you the PDFs, the PDF of that, billing codes. It sounds like there's some interest in that, and people can just either download it or they can push the delete button if they don't want it. But I think it's exciting that, the codes have been on the books for years, but people had you know, sometimes they would be reimbursed and sometimes it would be kicked back, and it was frustrating. And then sometimes they didn't know about, you know, whether they could use it and who could use it. And so there are some clinics that we've worked with that have been using them for several years, but it's just exciting that these MCOs have finally come together and formally said, these codes we will stand behind, and we've tested them, and you know, we want you to use them because we think it's a wonderful service for the community, and we think it's really going to help the clinics and the PCPs deliver care better, because again, we just have so much demand and not enough time.
Are any of the commercial carriers recognizing these codes?
It depends on the carrier.
Now, you said you worked with Blue Cross. Was that just strictly for their MCO, or do you know if they do?
So yeah, so these should be, and you know, like if you ask me case by case, like Blue Cross definitely is covering these billing codes, but you know, for Medicaid, you know, they were working specifically first for Medicaid, but they should be also covered for commercial and Medicare. But I would say that, you know, to check with your provider to make sure. And also too, if there's a really great interest in this topic, you know, we'll have Dr. Sa Hoffman on again. We have a webinar with him last week, but I think there's going to be a lot more questions and a lot more advanced questions. And so in a couple months, we'll probably have another webinar with him to answer some of these.
Yeah, and so you said Medicare. Do you think the Medicare Advantage plans are covering these as well?
They should be. They should be. There's no reason why they shouldn't, because again, they came together in Tennessee and agreed upon them. Now, nationwide, there's still the same issues that we'd had state by state, where sometimes they're covered and sometimes they're not. So your nationwide carriers, it's going to take some time. But this was for Tennessee. We got these plans together who agreed to cover.
Okay, so we talked about the T2P, which is called the transition to practice element, that would allow you to earn an additional 2 hours of CME, and that would entail filling out a form, which we're going to be sending with the CME certificate, just to kind of get you thinking about that and the interest. And then if you do want to implement that into your health coach into your practice, we give you 6 months to hire some, you know, get someone trained, hire them, and then document your results. What they're looking for are improved patient outcomes. And so that has to be documented and on file. And so once we receive those documents, then we would be able to issue an additional 2 hours of CME. Any questions on that? I think that's a fairly new concept for most of our members. We offered that at our annual meeting, and we did not have anybody take advantage of it. So I'm really hoping this is such a great concept. Having managed a primary care practice for 30 years before I came here, I certainly understand the need. We treated a lot of chronic conditions, a lot of elderly patients. We kept the wheels on. And this concept is just amazing.
Well, and again, it's integrating the individual into the team-based care so that they are a part of the clinical team. It is making sure that you keep them busy, keeping them busy with referrals, with outreach, and they can be quite productive and manage quite a large load in terms of, especially if they're doing most of their follow-ups by phone.
Have you had any resistance from patients?
You know, it's really interesting that patients look at this as a benefit, as a perk, that they get to have a health coach for free. In terms of, you know, how they perceive it, in terms of, you know, if they go to the gym and they want to work with the trainer, they have to pay extra for that. It's not covered by insurance. It's not something that's seen as part of their everyday experience. And so patients really love it. I actually worked with the clinic in Seattle where we had individuals that had severe mental health issues that were also on Medicaid, and a lot of them were homeless and had paranoid schizophrenia, and people thought that they would not participate in the program, and they loved the health coaching. We even recorded the sessions for training and education purposes, and the patients just were like, yeah, sure, I'm happy with that. And so we haven't had any pushback from patients. There may be people who don't feel they need health coaching at that time, but the concept of it has been very highly acceptable. In fact, in our model study, we had patient advocacy groups that helped us plan the study. And also we had evaluation that showed really good acceptance and satisfaction. We had a very low dropout rate in our study.
And so how does this compare with, I know some of the health plans, Blue Cross being one of them, if you have someone that's diagnosed with hypertension, say they would have a company reach out and say, we're going to provide you with a free blood pressure machine, and we're going, you call us anytime. We can talk to you about diet and exercise and monitoring your blood pressure. So how does this differ from one of those types of programs?
Well, remote monitoring is a very good service. In fact, our network has contracted with a vendor to provide discounts and to provide service. And the good news there is that they have access to our database. And so it doesn't, it's going to be less cumbersome. So remote monitoring, a company like that, if it's done well, is a very good service. I have worked with certain remote companies, and I will tell you that, they have really good concepts, but their staff are not trained to the level that we're talking about for health coaching. They're trained to ask questions and to gather the metrics and to try to, ask the person if they've used it. But health coaching is very different, and it's a very different skill than what's usually taught with those companies. Hey, we would love to train their staff as well, because that would be a good problem to have, that the patient had multiple people trying to help them with their lifestyle management.
So getting everybody under that one umbrella then would be an advantage, it sounds like, for patients.
And we also find that, I work with a lot of health plans, and they also offer some health coaching to individuals and care management. And some of their people are pretty well trained. Unfortunately, though, health plans are kind of seen as, like not so friendly, and they don't trust them as much. Whereas we've found that if you get a warm handoff from your doctor that you trust and the engagement is much higher. And so that's another reason that I'm really in favor of embedding the health coach into the physician office, because there's just a lot more trust there than some stranger calling them on the phone.
Yeah, absolutely. All right. Well, we've got just a few more minutes. Does anyone else have any other questions? Quiet bunch. This has just been a fantastic presentation, Dr. Butterworth. We really appreciate it so much, and we really appreciate the partnership. And like I said, this is part one. We've got 3 more parts to the webinar series here, and one will be, I think, on some remote monitoring. Next month, we'll be adding a pharmacist to your healthcare team, and then telehealth as well will be one of the webinar. So we're excited to have those coming up. Again, do we have anybody right off the hand now that that you feel like this is something you would like to engage in? All right, I've got one.
Definitely.
Okay. All right. Dr. Close. Okay, wonderful. So again, I will send that initial form out with the CME certificates. We'll have Dr. Butterworth's information too, so you can reach out to her. Or if you have any other questions, feel free to send them to me and I can forward them on to get answers there. The T2P activity, again, don't forget about that. If you have any questions, let me know. The first step, again, is filling out that initial form. And then we'll kind of follow up in a few months to see how things are going. And then at the 6-month interval, we will have that response form where you report your patient outcomes on that. Once that's received, then we'll give you a couple more credits. So, but you do have to work a little for it. So, again, if you have any questions, let us know. Again, we thank you so much for the partnership with the UT Heart Health Network. Again, we're trying something new for those that weren't on initially. As soon as the meeting ends, you should receive a survey. So if you will please go ahead and fill that out. It's just a few questions, shouldn't take you but a couple of minutes. We want the good, bad, and the ugly, so make sure you tell us exactly how you feel. We want to be a resource, and we want to make sure that we provide the information that you're looking for in the future. So please fill those out. I'll try to get your certificates out tomorrow, and if there's any questions, just let me know. Dr. Butterworth, you have any closing remarks? Or
no, just thanks, and reach out back channel if you have any questions and/or you've got experiences with integrating a health coach. Would love to hear about them later.
Okay.
Good luck. Thank you.
All right. Thank you so much. I hope everyone has a great evening and hope to see you next time.
Bye-bye.
Bye.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.